Everyone is talking about Ozempic. You've seen the headlines. You probably know someone who's lost a striking amount of weight on it, and perhaps you've quietly wondered whether it might be something for you. So let me give you the honest, balanced picture. Because if you're over 60, there are a few things about these drugs that matter very differently for you than they do for a 40-year-old. And almost no one is telling you what they are. I am not here to tell you to take it or not to. That decision belongs only to you and your doctor. I am here to make sure that when you have that conversation, you walk in genuinely informed. I'm Dr. Helen Kim. Here's what these drugs really do, what changes after 60, and the questions worth asking. First, what are they? Ozempic and Wegovy are brand names for a medicine called semaglutide. You may also hear of Mounjaro or Zepbound, which is tirzepatide. They belong to a family called GLP-1 medications, and they work by mimicking a natural gut hormone, one that curbs your appetite and helps steady your blood sugar. And here is something I want to say plainly, because it is simply true. These are genuinely powerful, genuinely useful drugs. They produce real, lasting weight loss. They control blood sugar remarkably well. This is not a fad, and it is not a scam. For the right person, it can be a serious and effective tool. They began life as diabetes medicines, and most are given as a small, once-a-week injection you can do yourself at home. And there is more, and this part matters most for us. In a large, careful study of people who already had heart disease, this medicine cut the rate of heart attacks and strokes by about 20%. In the same research, it also appeared to help protect the kidneys. Sit with that for a moment. A weight loss drug that, in the right patients, may genuinely protect the heart and the kidneys and add healthy years to a life. So when you hear real excitement about these medicines, understand that some of it is honestly earned. This is not all hype, and I would never pretend otherwise. And the weight loss tends to hold. In that research, people kept it off for years, not just months. But here is the part that changes everything once you are past 60, and it's the thing almost no one mentions. When you lose weight quickly on these drugs, not all of what you lose is fat. A large share of it, by some studies, a third, or even closer to 40%, is muscle. Now, for a 40-year-old, shedding a little muscle along with the fat is a manageable trade. But your body, past 60, is already losing muscle every single year, simply from aging. Stack a fast, muscle-costly weight loss on top of that, and you can quietly accelerate something serious. Doctors have a word for it: frailty. It happens because the weight comes off so fast and because you are simply eating so much less, so your body pulls from muscle as well as from fat. And this is just as true of the newer, even stronger drugs. And frailty is not an abstract word. It is a weaker grip on a jar. It is needing both hands and a push to rise out of a chair. It is a wobble on the stairs and a higher chance of a fall that changes everything. Recent research following older adults on these very drugs has found exactly this pattern: a faster loss of grip strength, a faster loss of muscle than you'd expect. Regular viewers know this is the thing I care about more than almost anything, because muscle is not about how you look. Muscle is your independence. There is even a name for the trap: sarcopenic obesity, where the scale and the mirror suggest you're doing well, while underneath, your muscle has quietly wasted, and you're weaker and frailer than you look. Muscle is the one thing these drugs can quietly cost you, if no one ever warns you to protect it. A few other honest things you should know. The most common side effects are digestive, nausea, and an unsettled stomach, and they are the main reason people stop. For older adults, there's an extra wrinkle. These drugs work by quieting your appetite, and if you're not careful, that can tip into eating too little, losing weight you didn't need to lose, and simply not drinking enough water. So appetite is something to keep a gentle eye on, not just celebrate. On the reassuring side, the studies so far suggest your bones hold up fine, which is good news. And one more thing worth knowing honestly. For many people, when they stop the drug, the weight returns, and it often comes back as fat, not as the muscle they lost. So without a plan, you can end up months later at the same weight, but with less muscle than you started with, which is exactly why the muscle piece matters so much. But there is one danger I need to name plainly, because it is where real harm is happening right now. Because demand is enormous, there is a flood of cheap, compounded, and online semaglutide being sold everywhere you look. Please hear me on this. That is where people get hurt. Wrong doses, mystery ingredients, contaminated vials. If one of these medicines is ever your path, it runs through a real doctor and a real licensed pharmacy. Never an internet shortcut, and never a deal that seems too good to be true. Your safety is worth more than the savings. So what do you actually do with all of this? Remember, this was never a yes or no video. It's a be an informed patient video. If you're considering one of these drugs, bring two things to your doctor. First, is this genuinely right for my situation, my other conditions, my other medications? And second, the question that hardly anyone asks, but that you now will. How do we make sure I lose fat and not the muscle that keeps me on my feet and independent? Ask it in exactly those words. A good doctor will be glad you did. It shows them you understand this isn't only about a number on a scale. It's about the body you want to be living in at 80. And here is the empowering part, because there is a real answer to that question. Whether you end up taking these drugs or not, the way you protect your muscle is exactly the same. Eat enough protein, spread across your day, not all at dinner. And do regular strength work, the simple chair-based movements we've built together on this channel, like standing up without your hands. That is how you make sure the weight that leaves you is the fat you wanted gone, and the strength that stays is entirely yours. The drug can lower the number on the scale. Only you can protect the muscle underneath it, and the best time to start protecting it is before, or as, you begin, not after it's already gone. Before my 3 things to remember, I'd love to hear from you. Are you or someone you love thinking about one of these medications? What's your biggest question or your biggest worry about them? Tell me in the comments. I have a feeling you'll find you are far from alone. 3 things to carry with you. Number 1. These GLP-1 drugs are genuinely powerful. Real weight loss, better blood sugar, and in the right patients, fewer heart attacks and strokes. The excitement is not all hype. Number 2. The catch that matters after 60. A large share of the weight you lose is muscle, not fat. For an older body, that can mean frailty. Muscle is your independence. Protect it with protein and strength work. And number 3. This is a decision for you and your doctor, never the internet. Never buy it compounded or online, and never start or stop any medication on your own. If someone you love is weighing one of these drugs, share this with them. An informed decision is always the better one. And if you'd like more honest, balanced health talk after 40, with no fear and no hype, subscribe and stay with us. None of this is medical advice. A decision like this belongs to you and your doctor. Take good care of yourself, and I'll see you in the next one.